Welcome to the Build Your Private Practice podcast, a space for Canadian therapists who want to support others, make an impact, and build a sustainable practice that works for them too. I'm your host, Liane Wood, a registered psychotherapist, group practice owner, and business mentor, and I'm here to help you build a private practice that allows you to keep doing the work you love without burning out. Because the people who need your help the most are counting on you, and you deserve a practice that supports you while you support them. Let's dive in. This episode is brought to you by Jane, a practice management software and EMR designed to help mental health practitioners run their private practice without running around. Managing a practice can mean juggling more tools than you ever planned to, one for booking, one for documentation, and another for billing. Each solves a small part of the puzzle, but because they don't work together, the manual admin still adds up. Jane helps practitioners connect their core tools in one place. Payments are taken and recorded directly in Jane, so billing stays accurate and is easier to track. And Jane Websites helps new clients find your clinic online. And if something needs attention, Jane's support team is available by phone, email, or chat with an understanding of how your entire system works together. For added peace of mind, Jane includes privacy and security features like two-step verification, role-based access levels, and HIPAA and PIPEDA compliance, so you can feel confident your practice and client data are protected. Practitioners know better than anyone that a little connection goes a long way. To learn more about how Jane can support you, your clients, and your practice, head to jane.app/demo. And if you're ready to get started, you can use my code BYPP2MO for a 2-month grace period on your new account. That's BYPP2MO. Hi there, and welcome back to the Build Your Private Practice podcast. I'm your host, Liane Wood, and today we're diving into a topic that's been sparking a lot of conversations in therapist communities lately: oversaturation. If you have scrolled through any Facebook groups of therapists or therapist forums recently, you've probably seen it too. Posts about how there are too many therapists, not enough clients, and a growing sense of fear that the private practice model might not be sustainable anymore. But is that really true? Or are we looking at the wrong problem? Today, we're going to break down what the data actually says about the mental health landscape in Canada, the myths about therapist oversaturation, and why the story might be a lot more hopeful than it seems. We're going to look at what's really going on beneath the surface because this isn't just about competition. It's about alignment, visibility, and adapting to a changing market. So, if you have ever felt like there are too many therapists and not enough clients, this episode is for you. So, let's start with the statistic that kicked off this conversation. According to a recent study by Mental Health Research Canada, only 11% of Canadians accessed mental health services in the last year. An additional 4% said they believed they should, but they didn't. That means 85% of Canadians didn't access therapy, even though we know the need is there. Now, that stat might sound discouraging at first, but actually, it's a huge indicator of untapped opportunity. And here's what I mean. If only 11% of Canadians are accessing services, we're not dealing with too much supply. We're dealing with a disconnect between what people need and what they're finding. It also tells us something important. The solution isn't to shrink the number of therapists. The solution is to close the gap between services and accessibility. Since 2020, the number of therapists and mental health professionals has grown steadily across Canada. More training programs have opened, more clinicians have entered private practice, and more practices are launching every year. The field is more crowded than it used to be, but that doesn't automatically mean it's oversaturated. And we have to ask, what do we mean when we say oversaturated? Is it really true that there are too many therapists, or is it that many therapists are still relying on outdated referral models, hoping word of mouth will fill their caseloads while clients are turning to Google, social media, and even AI to find help? Oversaturation suggests there are more providers than clients. Search interest for local therapy services has continued to rise over the past few years. People are actively looking for therapists online, but the way discovery works has changed. People are looking, they're just not finding you. So let's take a look at the bigger picture. Today, over half of all Google searches never lead to a website click because answers are delivered directly through AI summaries, featured snippets, map results, and rich search features. This is a big shift in how people are discovering information, and it's changing marketing for therapists. It means if your name isn't showing up in those answers, or your website isn't optimized for the way people search, potential clients may never even know you exist. Now, visibility isn't about being everywhere. It is about being findable when the right person is looking. And right now, that's a skill most therapists were not taught. Another piece of the puzzle is how therapists have historically relied on word of mouth, insurance directories, and physician referrals to fill their practices. And to be honest, that used to work. But in today's market, where people are turning to TikTok for mental health tips and using voice search to find services, relying solely on passive referral streams can leave you invisible. It also leaves your income unpredictable. This is not about hustling harder or posting more. It's all about shifting how you think about marketing from something you wait for to something you design. Now, I want to talk about the elephant in the room, corporate therapy platforms and national brands, because they invest tens of millions of dollars into advertising, brand recognition, and digital visibility on a scale that independent practices simply cannot match. They dominate ad space. They show up first in Google and they have huge marketing teams. But here's the thing, they can't replicate you. And the truth is, you're not meant to compete with them on spending. You're meant to compete on positioning. They can't offer the relational depth, the specialization, or the community connection that you do. What they offer is convenience and scale, but what clients are craving is connection and trust, and that is where you shine. So instead of trying to out advertise these platforms, we need to out strategy them. We need to get clear on our positioning, optimize our online presence, and build practices that are both findable and aligned. Now, I want to pause here and say something really clearly. You are not too late. You are not too small, and you are not behind. What we're seeing in the industry right now is not collapse, it's a crossroads. The private practice model isn't disappearing, it's evolving. And the therapists who will thrive in this next chapter are the ones who are willing to adapt, not by changing who they are, but by learning the business skills that let their work be seen, valued, and found. So, what does all of this mean for you? It means this is the perfect time to get strategic, to stop blaming yourself for not getting referrals, and to start building systems that work. It means you don't have to shrink to fit a crowded market. You get to stand out by being more yourself, more clearly in the right places. It means if you're willing to step into your role both as a therapist and a private practice owner, there is a path forward that feels aligned, ethical, and sustainable. If this conversation has resonated with you and you're ready to stop relying on referrals and start filling your practice with aligned paying clients, I want to invite you to check out our program, Accelerate Your Practice. It's designed specifically for Canadian therapists who are ready to fill their practices with right fit clients by taking control of their marketing without feeling salesy or overwhelmed. You'll learn how to get found by the right people, to build trust through your messaging, and create systems that support consistent practice growth, all with clarity and integrity. You can learn more online at buildyourprivatepractice.ca/accelerate-your-practice. Remember, there is room for you, and the clients who need you, they're already looking for you. You just need to make it easier for them to find you. Thanks so much for tuning in to the Build Your Private Practice podcast. If today's episode helped you reframe the oversaturation conversation, I'd love it if you'd subscribe, leave a review, or share it with a fellow Canadian therapist who needs to hear this. And as always, you can find more tools, programs, and free resources over at our website, buildyourprivatepractice.ca. You're doing important work, so let's make sure it supports you too. We'll talk soon. Thanks so much for tuning in to the Build Your Private Practice podcast. If today's episode resonated with you, I'd love it if you'd subscribe, leave a review, or share it with a fellow Canadian therapist who needs this. And remember, the work you do matters. Keep showing up, keep holding space, and keep building a practice that works for you. If you're looking for practical tools or support to grow your practice with more clarity and confidence, head to buildyourprivatepractice.ca. There's lots waiting for you there. I'll see you next time.